I'm going to check for danger as I'm walking into the room.
There's no danger.
I'm going to use the Dr. ABCDE approach to do my bedside, my end of bed assessment even. And I've got that off of the Resource Council. So first of all, I'm just going to start by saying, hello, my name's Aisha, I'm a student paramedic. Could you tell me your name, please?
Sarah.
Hello, Sarah. So from Sarah's response, I know that she's alert on the AFPI scale, that her airway is clear and patent, and that she's breathing, speaking full sentences. I'm also going to look for any accessory muscle use, any increased works of breathing to see if she's having any trouble breathing. Then I'll move on to the circulation. So I'm going to look at her skin, just see if I can see any paleness, if she's flushed, any mottling, any jaundice. Then moving on to disability, I'm going to do a quick fast test from here. I can't do a proper one, but just from what I can see, if there's any drooping. I'm going to see if there's any physical or mental impairment that I can see. And I'm also going to quickly assess the GCS at the moment, but I can't do it properly until I actually speak to her. Then I'm going to move on to the environment, to have a look around, see if I can see any medications laying about, what the house looks like, the temperature of the room, see how the patient's positioned, if there's any grimace on the face, if she looks like she's in pain. Anything to note?
No, nothing of note.
No. Okay, Sarah. So I'm just going to do some observations if that's okay with you and you're comfortable. Is that okay?
Yeah, of course, go ahead.
So I'm going to start by checking the radial pulse. I'm going to have a feel and have a listen one more time. So it should be between 60 and 100 beats a minute according to Bates. I'm also going to do the rest rate while I'm sitting here. That should be between 12 and 20 according to Bates again. Then I'm going to check the patient's SpO2, so just put it on my finger. In most patients, we want it to be above 98%, but if they have COPD, then it's okay if it's between 88 and 92%. Then I'm going to check the temperature, the patient's temperature, by using a tympanic. So check that. That should be between 36.1 and 37.2 according to NHS. Then I'm going to check the blood glucose levels. So just a little bit coming to the finger. Check that.
Ow!
Sorry. So I would hope that that would be between 4 and 6 in most patients. It can go up to 8 straight after eating. Just going to do a blood pressure as well. With blood pressure, anything between 90 and 140 systolic is okay. Anything below 90 is hypotensive. Anything above is hypertensive. And I'm going to just check the pupils as well. So I'm just going to shine a light in your eyes. You can carry on looking at my nose. I'm just going to check those. Just see whether they're equal and reactive. Is there anything there of note?
No, so we've got 80 beats per minute, which is regular and steady, pulse category 3. The blood pressure is 130 over 85.
Yeah.
Cap refill is less than 2 seconds.
Yeah.
The pupils are pearl at 3. Blood glucose is 9. Temperature 37.2. Resps are 20. They're normal, regular. The lungs are clear. And her SATs are 99 on air.
All right, lovely. Okay, so from the observations, I don't think that this patient is time critical. I'm just going to ask you a little bit more about what's been going on, Sarah. So what is the exact reason you've called us today?
My tummy hurts.
Okay, so I'm going to use Socrates to assess the patient's pain according to Hercules 2012. So when did this start? Whereabouts is the pain, Sarah?
On the right-hand side.
Okay, is that all over the right-hand side, or is that localised to the upper or lower?
No, it's all over it.
All over. Okay, and when did this start?
Probably about 7 o'clock yesterday evening.
Okay, and was you doing anything at the time that it started? Anything that brought it on?
No, just watching the chase.
Okay. So what kind of pain is it? Is it dull, sharp, stabbing?
Kind of dull.
Okay. And does the pain radiate anywhere?
Well, it's kind of everywhere, but it's worse on the right-hand side.
Okay. And is there any other symptoms that come along with this? Have you been vomiting, have any diarrhea, any other pain anywhere else?
Well, I feel sick, and I was sick at about 5 a.m.
Okay, and when you threw up, what did it look like? What colour was it? Was it food in there, or
just normal?
No blood?
Don't think so. I'm not a doctor.
Okay, but no red streaks or anything?
No, I couldn't see anything.
Cool. So Is it constant, the pain, or does it come and go?
No, it's constantly like there, but it gets really bad, like really sharp at times.
Okay. And is there anything that you do that makes it worse or better? Does anything bring on that sharp pain, or?
No, it's just random.
No positioning makes it better?
No.
Okay, that's fine. And if you had to score this pain on a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, what do you score it as?
Well, at the moment, when it's just kind of dull, it's at a 3. But when it gets really bad, probably about 6.
Okay then. Okay. So I'm just going to ask a few more questions. So have you been generally well in yourself recently?
Yeah.
Yeah. What's your appetite been like? Have you been eating well?
I had a sandwich last night, but that was it.
Yeah. So up until this episode, has your appetite been okay?
Yeah, it's been normal.
Yeah. Any unexplained weight loss or night sweats?
No.
No. Have you had any trouble swallowing or any pain on swallowing?
No, it's been fine.
No. And what have your bowel movements been like? Have they been normal? Any increase in frequency, change in colour or consistency?
No, I think they've been all right.
Good. What about your urination? Has there been any changes in that? Any frequency, in urgency or colour? Any burning sensation when you go?
Not that I've noticed.
No. And sorry to ask this, but do you still have menstrual periods?
Yeah, I do. About 4 weeks ago.
Yeah, 4 weeks ago. And was that normal?
Yeah.
And are you sexually active at the moment?
I am.
You are. Is there any chance that you could be pregnant?
Oh, I'm on the pill.
Okay. There is still a chance that you can become pregnant if you're on the pill.
Oh, that's not good.
Yeah. Not 100% effective, unfortunately. Okay. So I'm going to have a more in-depth look at you. So I'm going to be having a look at your hands and your arms, have a good look at your face, and I'm going to be having a look and a feel at your stomach. So it might be a little bit uncomfortable. If you want me to stop at any point, then just let me know. Is that okay with you?
Yeah, go ahead.
Are you comfortable how you are at the moment?
Yeah.
Yeah? Okay. So I'm going to start by looking at the hands. So I'm looking for colline shears, which is spooning of the nails. This can happen with liver disease. Sorry, what was it? I just got a complete blank.
Just go into it. That's what happened. I was like, just thinking. I've got a thing. So it's the cap. So Palmer.
Yeah.
Is this? Yeah, Palmer, clubbing, asterixis, cyanosis, and colline.
Yeah, colline shears.
So PCAC, and then it's Jax CD for the face. So JAAXCD. So it seems really simple in my head because Jax was from Sons of Anarchy.
Yeah, I wouldn't remember it like that. Okay.
That's why I was saying PCAC earlier. I wasn't going to be a bird.
Okay. So colline shears, spooning, liver disease.
What?
I'm just making sure that I've said what I meant to say.
Yeah, so hold on, let me read you what I put here. So, what one are you doing?
Colline shears.
Yes, spoon nails indicate iron deficiency.
Oh god, yeah, no, sorry. That's why I was like, I said liver disease, and I was like,
Yeah.
it's not right here.
So, spoon anemia.
Yeah.
So spoon the iron. I think irons are made of spoons.
Yeah.
No,
It's clubbing that can be a sign of liver disease.
Huh?
It's clubbing that can be a sign of liver disease.
Yes. Or inflammatory bowel disease.
I didn't know that one.
Because it's Bates, so it's probably not true.
Alright, start again.
Okay, so I'm going to call out. Hello, my name's Martha. I'm a
Is that what you're talking about?
Yes. Good thing you paused it.
Yeah.
My name's Sarah.
What, that's on the recording now?
I've actually got something
Sarah's
else.
going to come round. So as I came in, I was using the...
Oh, you could have asked about pain relief, that was it.
Oh god, yeah, meds.
Yeah, but you don't know about meds because you asked about the contraceptive.
Yeah, but in my sort of framework that I've done for myself, I'm doing
It's
the
alright.
history and then gone to meds and ask.
Well, to be fair, you could do that at the end. You
Yeah.
could say something like, now that I've poked and prodded you,
Yeah, I put it in with my social and family.
have you overdosed on paracetamol because you're not happy with your children?
Because you think the child's a boy.
If you even remember it.
Okay, so I'm going to start by checking the hands. So I'm looking at the nails. So first of all, I'm looking for colline shears, which is spooning of the nails. This happens in chronic anemia, so if there's an iron deficiency. and that could indicate there's a GI bleed, GI malignancy, or malnutrition. I'm also looking for clubbing in the nail. So if I ask the patient to put their fingers together like that, you're looking for a window between called scale mouse window. That is normal. If there is no window, that indicates there's clubbing, and clubbing can be a sign of liver disease, but also a sign of cardiovascular or respiratory disease. I'm looking on the palms for palmar erythema, so that's red blotches on the palms. That can be a sign of liver disease, but it can also be normal in hyperdynamic states such as pregnancy. I'm also looking for any peripheral cyanosis, so checking the fingernails and the tips of the fingers for any blueness, which could be a sign of poor oxygenation. If I can just get you to put your arms out like this, Sarah. So I'll be looking for any flapping motions in the wrists. That could be a sign of liver disease or CO2 retention. I'm also looking for Dupuytren contracture, which is when one or more fingers becomes stuck in a flex position. That can be a sign of liver disease also. Then moving on to the arms. So I'm just checking the arms for any track marks, as this could be a sign that the patient is an IV drug user, meaning they're at high risk for hepatitis. I'm also looking for any petechae, which is little red spots on the arms, which are broken blood vessels, which can be seen in liver disease. Then I'll move on to the face. So I'm looking at the skin colour, looking for any yellowing in the skin or any yellowing in the eyes, in the whites of the eyes. That's caused by a build-up of bilirubin in the blood when somebody has liver cirrhosis through the increased destruction of red blood cells. I'm also going to be looking for any anemia while I'm looking at the skin colour. Look at the conjunctiva for any pallor. So I'm just checking the pallor there, sorry, putting your eyelids down. And I'm going to look for any central cyanosis. So looking at the lips, the tongue and oral mucosa, just see if there's any blueness there, because that can be a sign of very poor oxygenation. Then I'm going to be looking around the eyes for xanthelasma, which is white or yellow nodules around the eyes. That could indicate that the patient has high cholesterol, or if they have white or blue rings around the iris, that's arcus senilis, and that could indicate they've got hyperlipidemia. Then I'm going to move on to the neck. So I'm going to check all the lymph nodes. So we've got the preocular, the postocular, the submental and the submandibular. So just checking for any swelling or tenderness, which could be a sign of infection. The most important node is Virchow's node, which is located above the left clavicle. That drains lymph directly from the GI tract, so any swelling there could indicate a GI malignancy. So is that all okay?
Yeah, everything's fine.
Yeah. Then I'm going to be checking the JVP. Can we just pause it a minute? Got a really dry mouth.
I'm stuck to the door.
Can I sip of your drink?
Yeah. My toolkit. Down.
Not that kind of film score.
That's not what we were told. You'd be down here. I said to Gemma, if you need someone to come fix a photocopier, you're all available.
Oh, my mouth is really dry.
So have you got dual angles?
Yeah, this one's close enough, whereas that's.
I've brought comedy. I should bring in the intellectual.
Someone's got to try and do that.
Right. Okay. Don't say anything.
No, I'm not
Don't look at me.
Right, let me just get back to where we were. So you were at the
I was just about to do the JVP.
Okay,
Yeah.
and whenever you do the JVP, I'm going to just move around a little bit.
Yeah.
So it's really quite hard to see on that side of it. So you might just need to like pull it top down. Or
Or
something.
why don't you just do it on the other side and pretend that?
That's okay. That's okay like that. Can I be in it?
What?
I'm videoing it.
You went on to took a photo
Oh,
of
was
you?
it? Oh,
What if
I
I'm
didn't
the
have my
patient?
teeth
Are we
out.
going like
You did.
that?
How can you do it with me, like with my mouth closed?
No, not really.
I always have
Or
my
if
mouth
I'm the
open.
patient, Aisha can be assessing me and you film it.
We haven't got a shutter speed fast enough to catch you with your mouth closed. So
So if you want to do another one with you as a patient?
Oh no, I meant just the photo.
Oh, yeah.
Definitely not. We're not getting my weird ribs out on YouTube.
Oh, we're not
Just
doing
talking to me
definitely
left,
something wrong
right,
with
and
the
centre.
patient.
Going, have you had that checked?
Okay.
Right. 3, 2.
So I'm just going to check the JVP. So I'm going to lay the patient at a 30 to 45 degree angle. So So I'm just going to lay you back slightly, Sarah, if that's okay. So let's just say about there. I'm going to ask her to turn her head away from me. You can just do that for me. And then I'm looking for the internal jugular vein. You can distinguish this from the carotid because it will be non-palpable and there's 2 pulses per cycle. So if you palpate it and you can feel a pulse, then that's the carotid. So make sure you've got the internal jugular vein. Then you want to measure from the top of that pulse vertically to the angle of Louis, and you don't want it to be more than 4 centimetres because that could indicate that there's portal hypertension or something else going on. Okay? So just turn your head back. Lovely. So now I'm going to go on to inspect your abdomen. So I'm going to use the IAP framework so that I don't disturb any bowel sounds by palpating first. So I'm going to start by inspecting. I'm just going to open this up, if that's okay, Sarah? So I'm just having a look, looking for symmetry first of all to see if there's anything obvious standing out at me. Then I'm looking for any pulsating masses, which could indicate that they've got a AAA going on. Then I'm looking for any stoma sites, any scars which could indicate previous surgeries. Looking for distension. So when we talk about distension, we want to think about the 5 Fs. So you've got fat, fluid, fetus, flatus, and feces. So just make sure that there's nothing obviously distended. And I'm looking for
Scars, distension,
masses,
hernias, stoma, grey turners and Collins, spider nervae, stray, foot medusa, gynecomastia.
You do know that you said I'm just going to lie him back a little bit, back and go, sir, and then I'm going to have a look at
Sarah.
What's your back?
I said Sarah. That's just me not talking properly. That's why we don't want you in here, Scott.
I was just wondering, she's called him sir a minute ago. There's a Sarah. I know they're gender fluid now. But...
Well, exactly. I'm just not presuming gender. All right. Okay. So where did I get to? What was the last thing that I said? Distension.
Can't remember.
No, scars, stomas.
No, I haven't.
Oh, I thought you were taking.
Well, I kind of am, but I can't remember the last one she said.
Okay.
Have you said hernia?
No. I think I was meant to say masses next. Then okay.
No, I think you said masses.
I said distension.
No, you've said masses.
I think you did at the start.
Yeah, you started
I
with
think
masses.
you did at the start. Yeah.
All right.
Doesn't matter if you repeat
So-
yourself.
Hernia, stoma, Collins and grey turner, spider nervae, stray, foot medusa, gynecomastia.
Okay.
Okay.
Yep. Okay.
3, 2.
So I'm also looking for any obvious hernias anywhere, so any muscle poking through anywhere. Then I'm going to look for any discoloration, so specifically Collins and grey turner signs. So grey turners is bruising around the flanks and Collins is bruising around the umbilicus. This can be signs of a retroperitoneal bleed, a pancreatic bleed, or a ruptured ectopic pregnancy. It could also be a sign of a ruptured AAA. Then I'm looking for any spider nervae, which are little red dots with red branches coming out of it like a spider. That can be a sign of liver disease. Looking for any caput medusa, which is enlarged veins around the umbilicus. This can be a sign of portal hypertension, so possibly liver cirrhosis, or also an obstructed inferior vena cava. Sorry, I don't know. Something's come into my head that I've forgotten.
What's something additional?
Huh?
Something additional.
Of course, it's something additional.
No, it's something that I was. I'm just putting myself off. Okay, don't worry.
Sure.
Yep, what have I said? I've said discoloration.
Mm-hmm.
So you need
medusa.
You said vena cava was the last thing.
Gynecomastia.
Yep.
That's pretty much it.
So just
Stray of gynecomastia.
alright. So
Okay.
yeah.
3, 2.
Also looking for any striae, which are stretch marks. So this could indicate they've had rapid weight gain, such as pregnancy. And if this was a gentleman, I'd also be looking for enlarged breast tissue, which is called gynecomastia, which could indicate either obesity or an underlying issue such as liver disease or kidney disease. And also patients who are having dialysis sometimes can get enlarged breast tissue. So then I'm going to go on to auscultate. So I get my stethoscope. So I'm just going to have a little listen to some, if that's okay.
Yeah.
Yeah. Okay. So I'm going to start in the lower right quadrant. And I'm going to listen for up to 3 minutes. And I'm going to move in this direction because that's the way the flow of the bowels go. So let's have a listen. Heard a sound, so I'm going to move on. Yep. 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 So I'm just going to make a note of whether they're active, normal, reduced, or absent.
No, they're all normal.
Okay, Sarah, so now I'm just going to be percussing, so I'm just going to be tapping on you. So first of all, I'm going to start by, I want to check the size of your liver. So the liver is usually located around the 5th rib, or 5th intercostal space. According to Stanford Medicine, it is 4 to 8 centimetres mid-sternal and 6 to 8 centimetres mid-clavicular. I'm going to start at the 3rd intercostal space, mid-clavicular, and I'm just going to start by percussing. I'm going to move down until the sound becomes dull. Once it becomes dull, that's the upper border of the liver. I'm going to do the same from below the umbilicus, just coming up. And then once you hear it go dull again, that's the lower border of the liver. Then I'm going to move on to assess for splenomegaly, which is an enlarged spleen. So I'm just going to get you to lay back for me, Sarah. So just lay me back. So the spleen is usually 3 by 5 by 7 centimetres and located between the 9th and 11th rib. So I'm just going to find the last intercostal space and go at the anterior axillary line. And I'm going to percuss. It should sound tympanic. Then I'm going to ask Sarah to breathe in. If you just take a deep breath for me, Sarah. And then I'm going to tap again. If that has now changed to a dull sound, it could be a sign that the spleen is enlarged, and I might want to go on to give it a bit of a palpate. But if that's fine, then I'll move on. Is that okay?
Yeah.
Yeah. So now I'm going to assess for any ascites. So getting the patient to lay down, I'm going to start percussing just above the umbilicus, and I'm going to move towards me. If it becomes dull suddenly, I'm going to keep my finger there and roll the patient away from me. I'm not going to ask you to do that, Sarah, because we're in an awkward position. That's what I would do. Then wait for a minute, and then I'm going to percuss again. If it's now tympanic, that's because there is a ascites there which has shifted over to the other side. Okay, so that's all my percussing done. I'm going to do a few tests by pressing on your stomach. So do tell me if there's any discomfort here. So I'm going to start by assessing for appendicitis. So I want to find McBurney's point, which is 1/3 of the way between the iliac crest and the umbilicus, so about here. And I'm going to palpate deep. Is there any pain when I palpate?
No.
No. And then I'm going to check for rebound tenderness. So rebound tenderness is when you release your hand quickly and there's increased pain on the release. So I'm just going to do that.
No.
No pain?
No, it's fine.
Then I'm going to do the same thing on the other side, checking Robson's sign. So I'm going to press deeply, and you tell me if there's any sign, any pain on the right hand side.
No, that seems alright.
Okay. Then I'm going to do the Sower sign, which I'm going to have to get you to get into some funny positions here. So I'm going to get you to roll towards me, if that's okay. And then I'm going to ask you to just extend this leg behind you and tell me if there's any pain. Any pain when you do that?
No, that seems alright.
Then I'm going to check obturator sign. So I'm going to ask you to lift this leg up for me, and then I want you to rotate the knee inwards. Is there any pain when you do that?
No, that seems alright.
So from the tests I've done, it doesn't seem like this patient has appendicitis. They're all negative. I'm just going to sit you up again, if that's okay.
Yeah.
Actually, while I've got you laying there, I'm going to just check the cholecystitis. So that's going to involve me putting my hand under the costal margin and asking you to take a deep breath. So if I just put my hand there, you take a deep breath for me and tell me if there's any pain. So if that was positive, the patient they would stop taking that breath in because the pain would hurt so much, and that would be indicative of inflamed gallbladder. Okay, so I'm going to sit you up now. And the last test I want to do is just to check your kidneys. Have you had any pain in your kidneys at all? Any pain around your back?
No.
No? Alright, I'm going to lean you forward. And then I'm going to find the costovertebral angle, which is between the last rib and the spine. And then I'm going to just place my hand there and just give it a light tap on both sides. Is there any pain?
No, that seems
Right.
right.
Okay, so that's all the examination done. I'm just going to ask you a few more questions, if that's okay, Sarah.
Yeah. Go ahead.
Do you suffer with any medical conditions?
Not that I can think of.
No. And do you take any regular medications? That's that over the counter, prescription, herbal, recreational?
No, just the pill.
Okay then. And have you taken any pain medication for this pain in your stomach?
Yeah, I took some ibuprofen and paracetamol earlier.
Do you know what time earlier?
About 2.5, 3 hours ago.
Okay. Did that help with the pain at all?
Yeah, it's a bit better now.
Yeah. Okay. So did you take that on an empty stomach?
Yeah, does that matter?
It can cause stomach pain taking ibuprofen on an empty stomach.
I'll do.
Okay, so just a few more questions about your social life and your history, your family history. Does anyone in your family suffer with any medical conditions that run in the family?
No, nothing springs to mind.
No. So no heart attacks, nobody died of any heart attacks young, anything like that?
No, nothing like that.
No. Just a few more questions about your health. Can I just go through a few things and you tell me if you've ever had them before?
Yeah.
Ever had a heart attack?
Nope.
Jaundice?
Nope.
No. TB?
Nope.
Any rheumatoid arthritis or rheumatic fever?
Nope.
No. Epilepsy?
Nope.
Asthma?
No.
Any diabetes?
No.
No. And any strokes?
No.
No. Okay, that's fine. So who do you live with, Sarah?
Just my partner and my daughter.
Okay. And what do you do for work?
I'm a cook.
You're a cook. Okay. And do you smoke at all?
No, I don't.
And what about alcohol? Do you drink alcohol?
Probably 12 units a week.
Okay. Okay then. So that brings us to the end of the examination. So I'm thinking I would probably like to take you into hospital. I'm not completely sure what this is. From your observations, you could have an infection somewhere. Your temperature is just on the borderline of being high, and your blood glucose is slightly high, which can indicate an infection going on somewhere. I've checked for cholecystitis. That's coming up negative at the moment. Doesn't mean you don't have it. You could have a urine infection or something, and it's been 4 weeks since your last period. Although you're on the pill, there is still a small chance you could be pregnant, and this could be an ectopic pregnancy or something like that. So I would rather take you into hospital to get all this checked out. How do you feel about that?
No, I don't want to go.
So do you understand the risks of me leaving you at home if this is something more serious like an ectopic pregnancy and it ruptures?
I understand everything you're saying, but I can't leave my daughter.
Okay. So in that case, what I would like to do is definitely put in a referral to your GP. Would that be okay with you?
Yeah, I think it's best.
Yeah, I think that you need to speak to somebody. And so leaving you at home, I just need to leave you some really important information. If this pain gets unbearable, if you get any big obvious bruising around your sides or around your belly button, then do give us a call back. If you get any chest pain, any problems breathing, definitely give us a call back. You can ring 111 if you want any more advice about anything. Keep on top of your painkillers, but make sure you're leaving those 4 hours in between and don't go over the recommended dose in the box.
Can you write it down for me as well?
Yeah, I can write that all down for you. There you go, I'll leave it on the side here. I'm also leaving my paperwork with you. Make sure you keep that safe, because if another ambulance is called, it's always good for us to have a look at that paperwork. Okay?
Yeah, I think so.
Yeah.
Thank you very much.
Okay. All right. You take care.
Bye. Bye.